Thank you for joining today's lecture on membranoproliferative glomerulonephritis, MPGN. MPGN is a complex glomerular disease characterized by immune complex deposition and proliferation of glomerular cells. Understanding the intricate pathophysiology and clinical manifestations of MPGN is crucial for accurate diagnosis and effective management. The glomerulus is a vital component of the nephron responsible for filtration of the blood and formation of urine. Its complex structure comprises the glomerular filtration barrier, which consists of fenestrated endothelial cells, a basement membrane, and podocytes. Together, these elements regulate the filtration of water, electrolytes, and waste products. Additionally, mesangial cells play a crucial role in maintaining glomerular hemodynamics and structure. Understanding the anatomy and physiology of the glomerulus is essential for comprehending the pathogenesis of MPGN. MPGN is primarily an immune-mediated disease characterized by the activation of complement pathways and subsequent immune complex deposition within the glomerulus. Multiple mechanisms contribute to immunopathogenesis, including abnormal activation of the classical and alternative complement pathways, immune complex formation, and deposition. The interplay between these mechanisms leads to inflammation and damage to the glomerular filtration barrier. Exploring the intricate immune mechanisms involved in MPGN provides crucial insights into potential therapeutic targets. MPGN can be classified using different systems, including the older classification based on light microscopy findings, type 1, 2, 3, and the more recent classification based on electron microscopy findings. Type I MPGN is characterized by mesangial and subendothelial deposition, while type 2 MPGN involves dense deposits in the glomerular basement membrane. Type 3 MPGN exhibits a combination of both subendothelial and intramembranous deposits. Familiarizing oneself with these classification systems is essential in understanding the heterogeneity and prognosis of MPGN. The clinical presentation of MPGN can vary widely, making early detection and diagnosis challenging. Common symptoms include hematuria, visible or microscopic, proteinuria, often nephrotic range, and hypertension. Other manifestations may include edema, decreased urine output, and symptoms related to renal impairment. Recognizing these diverse clinical manifestations is crucial for timely diagnosis and appropriate management of MPGN. Renal biopsy plays a crucial role in confirming the diagnosis of MPGN. Histological examination of renal biopsy specimens reveals characteristic features such as mesangial proliferation, capillary wall thickening, and glomerular basement membrane abnormalities. Immunofluorescence studies aid in identifying the immunoglobulins and complement deposits within the glomerulus. Accurate interpretation of these biopsy findings is essential for establishing the diagnosis of MPGN and differentiating it from other glomerular diseases. Distinguishing MPGN from other glomerular diseases that mimic its clinical presentation is crucial for appropriate management. Conditions such as lupus nephritis and IgA nephropathy may exhibit similar clinical features to MPGN. Detailed knowledge of the distinctive histopathological findings and immunofluorescence patterns helps in making an accurate differential diagnosis, which is crucial for implementing appropriate treatment strategies. Laboratory investigations play a vital role in diagnosing and monitoring MPGN. Renal function tests, including serum creatinine and estimated glomerular filtration rate, EGFR, provide information about renal function and help track disease progression. Assessment of complement levels and autoantibodies, such as anti-factor H antibodies, aids in understanding the underlying immunological abnormalities in MPGN. Utilizing and interpreting these laboratory tests assists in establishing the diagnosis and monitoring disease activity. Imaging modalities, such as renal ultrasound and computed tomography, CT, scans, complement histological findings and aid in supporting the diagnosis of MPGN. Renal ultrasound can help evaluate kidney size, detect any structural abnormalities, and provide information on the presence of nephrolithiasis or hydronephrosis. CT scans may be useful in identifying possible causes of secondary MPGN, such as underlying malignancies. Understanding the role and utility of these imaging modalities is essential in the diagnostic workup of MPGN. Treatment strategies for MPGN aim to control inflammation, preserve renal function, and manage complications. Immunosuppressive therapies, such as corticosteroids, cyclophosphamide, or mycophenolate mofetil, may be employed to suppress the immune response. Antihypertensive medications help control blood pressure and reduce the risk of progressive kidney damage. Additionally, supportive care measures, including salt and fluid restriction, are essential in managing edema and maintaining fluid electrolyte balance. Evaluating the various treatment approaches ensures optimal management of MPGN patients. The prognosis of MPGN varies depending on the underlying cause, histological subtype, and response to treatment. Chronic and progressive kidney damage can lead to end-stage renal disease, ESRD, requiring renal replacement therapy. Complications such as nephrotic syndrome, hypertension, and recurrent infections can impact the long-term outcomes of MPGN. Recognizing these potential complications and understanding their impact on renal function and patient outcomes aids in guiding clinical management decisions and providing appropriate patient education. MPGN can have genetic underpinnings, and familial forms of the disease have been identified. Understanding the genetic aspects of MPGN, including associated gene mutations, is crucial for genetic counseling and early detection in families. Identifying affected family members and providing appropriate screening and counseling can help prevent or mitigate the progression of MPGN in high-risk individuals. Ongoing research in the field of MPGN is focused on identifying novel therapeutic approaches. Complement inhibitors, targeting the abnormal complement activation observed in MPGN, hold great promise. Targeted immunotherapies, such as monoclonal antibodies, aim to modulate the immune response specifically involved in the pathogenesis of MPGN. Staying updated on these emerging therapies is essential for providing the best possible care to MPGN patients. In conclusion, membranoproliferative glomerulonephritis, MPGN, is a complex disease affecting the kidneys. Understanding its anatomy, pathology, symptoms, and treatment options is important for accurate diagnosis and management. Ongoing research provides hope for future treatments.